This is Cadillac Unscripted on 107.9 CDY. Every Saturday morning at 8:30, it's brought to you by Independent Bank, and we talk about interesting things going on in and around the Cadillac area. And Katie Huckle is my co-host, and I got to tell you, Katie, I believe it was Robin Sims who emailed me about a month or so ago and said, there is a dermatology office open in Cadillac, and I'm not sure that a lot of people know about it.
Right.
Because, a lot of people think they have to drive to Traverse City or Grand Rapids for dermatological care. And so we have two of the providers, is that the proper term, from V Dermatology with us. We have Libby Tuck and Naila Russell.
Welcome,
Hi,
ladies.
Thanks for having us.
Anyone who has raised teenagers, let's talk about dermatology teenagers.
Oh, goodness.
I mean, it's true, Rich. If you are having major skin issues, you're traumatized. We live in kind of a superficial world, to be honest, especially with social media. And so I can remember some of our dermatology crisis in my house with teenagers, and it was like, stop everything. Let's get this handled so that when kids go to school that they feel confident and they're not self-conscious. So we're glad you're here.
Absolutely. We have a lot of patients who come in with acne, definitely teenagers. But, I think one of the things as a woman in my 30s that drives me crazy is like people tell you acne is just a teen thing, and it's totally not.
No.
So, it just continues on into life sometimes, and we are absolutely able to manage those types of things, both like from the medical standpoint, but then also, after things are better, then cosmetically as well, like to help with scarring. And we just have a lot of options that exist now that weren't necessarily around before too.
Right. Everything's skin. And we know your skin covers everything, and we need to be careful with it. I think Rich and I are older than you ladies, but you start like really getting nervous about moles on your family and moles on your friends and moles on yourself. And so can you talk about some preventative care and things that we should be seeing you for?
Absolutely. And like really the prevention needs to start from day one. So the kiddos, they need to be wearing sunscreen, because we have a lot of patients who are like, I was of the baby oil generation and I was out, just frying their skin essentially. So I think the number one thing too, even to stave off signs of aging, is sunscreen and moisturizer. And it doesn't have to be anything fancy. Walmart, I think, has like the greatest selection of sunscreen. SPF 30 or higher. And the key is to reapply every 90 minutes, because it only lasts that long. And that's where so many of us fail and end up being sunburned. So that's the thing to think about. And then, we really encourage people to keep an eye on their moles and freckles, to look for those ABCDs and the E's. So that's if anything's asymmetrical, has any irregular borders, any color variation, or diameter greater than 6 millimeters, and then anything that's changing. And we do have a lot of people who are like, yeah, I've had this mole forever, but it's different now. And that's always a red flag.
Okay. Where are you located?
So we're located on Cobb Street, right behind the hospital. So
great.
For people who've been around Cadillac for a long time, it's where the old urgent care used to be. We're in that building. And we actually share a space with Dr. Haringa for the Northwest Vein Specialist. So it's a combined building.
Right.
But
wonderful.
Yeah.
Yeah. Can we talk about, when we talk about sunscreen, is it true that has a shelf life? I mean, yes, we need to reapply every 90 minutes. How long, let's say you buy sunscreen in June, how long is that sunscreen working?
So as long as you're storing it properly, it's probably good for about a year. So every year you're going to want to kind of clean out the cupboards and get new stuff. But if you're keeping it in your beach bag and it's, heating up to 120 plus degrees in the car, then, it's really not great for the products. So I would say at that point, you maybe want to just throw it out and get something new. But if you're putting it on every 90 minutes, you should be going through it pretty fast.
Okay. Exactly. When you talk about, preventative from the very beginning, how do you coach kids on this? And can you give us some pointers?
Yeah, I think it's really, of course, getting the parents involved and invested, because they're the ones who are going to be at home with the kiddos, making sure that when they're little, they're running after them down the beach and spraying them. Also, with the sprays, you have to rub it in. You can't just be spraying them as they're running by you. It's really, really important that it's going to get rubbed in. But yeah, definitely with education, with parents, I think, society is a lot more aware now than they were before. So actually, most of our parents are like, oh yeah, like my kiddos are being protected. And even the schools, when they have field day and stuff, they're like, send the sunscreen, put the sunscreen on before they come into school, things like that.
Yeah, and I think it's just really important as parents that we set the example too. Like, so my kids don't want to do anything unless, well, why aren't you doing it? So definitely setting the example too for your kids and showing them like, this is normal. This is what we do.
And, we live in an era where the sun is more intense than it used to be, so it doesn't take as long to burn, right?
Right.
Okay. How long, in your experience, if you're out, we're recording this on a day when there's beautiful sunshine, cloudless skies, it doesn't take long, right? I mean, how long really does it take?
So if you're going to be outside for more than 15 minutes, you should be applying sunscreen.
Okay.
And you're actually supposed to put it on 15 minutes before you go outside. So it's all about the planning.
Okay. So 15 minutes before you're going to hit the sun. Okay. And then every 90 minutes. What about going in the water and sunscreen?
Well, the great thing is you definitely want to check to make sure the sunscreen is, water or sport safe, because a lot of times we're sweating too. And so it feels like it's beating off. But they are made to withstand that. Okay. So as long as it says that on the product, you should be okay. But again, it's just making sure you're putting it on 15 minutes ahead of time, going in the water, and then really, why not just put it back on after you're outside of the water and sitting on your, your chair, soaking up those sun rays.
Okay.
Something that people don't think about too is when you're going on a long trip or if you're driving a lot of people get a lot of sun exposure on their left side.
Yep, your arms hanging out the window.
Yeah,
right?
So just being really aware of that. You don't realize it because you're sitting in an air-conditioned car, and it's just not something most people think about. But we do see a lot of more skin cancers on the left side.
Isn't that something?
And that's something you really don't think about, right?
No.
Yeah.
No.
Yeah. I want to talk a little bit to both of you about your backgrounds and how you ended up doing what you do and being at V Dermatology. So, Libby, you're holding the microphone, so why don't we get your background first?
So, I moved here. I was born and raised in Traverse City, and I moved to Cadillac in 2009. And I started working in the emergency department. I worked there for years. So I have a significant background in that, and then I did primary care for a while. So I've done quite a bit with skin disorders through that. I mean, you do a lot of derm in both those fields. And then I always had a passion for skin and for the dermatology field. So obviously, when I moved here, we didn't have dermatology here. Mm-hmm. So it wasn't really an option. But then when this came about, I applied for it and did a lot of extensive training, a lot of hours of studying and coursework and stuff. And here we are. So,
and they hired you and they said, okay, we're going to train you a little further in this.
Oh, yeah. It's a specialty. So you have a lot of specialized training. So yeah, and I'm just super thankful to be able to have this for our community because in working, in emergency medicine, but also in primary care, it is super frustrating not to be able to send somebody to the specialist that they need because of transportation issues and stuff. So it's a huge blessing for our community, I feel.
How long has V Dermatology been open? Then I'll get to you, Naila.
So V Dermatology started in Traverse City. Their main office is in Traverse City. So that started in 2017, and then he opened this office in 2021.
Okay.
Good.
Naila, give us your background.
Yeah, so, both Libby and I are nurse practitioners, but just like Libby, I'm also a family nurse practitioner, started out my career in primary care, but I actually was born and raised in Suttons Bay, Michigan, and so closer to Traverse City, but was most recently working and practicing in Maryland, and that's where I had the opportunity to learn about dermatology. So I've been doing dermatology for 5 years, and just like Libby said, it's really we get a lot more extensive training through kind of like on the job. So the physicians who hire us, who are board certified dermatologists, they hire us and then train us really, closely before giving us the blessing to move ahead and have our own patient panel and see our patients independently. So that's where I learned all of my dermatology background, was in Maryland. And then when I moved back to the area last summer, wanting to continue on the path of dermatology, I was fortunate enough to be hired by Dr. Van Vrede. And one of the reasons, I think, was because, he had this clinic in Cadillac, and he has this vision of growing and serving the community. There's so many dermatology practices in Traverse City, but Cadillac was in need. And I think he really has this vision of trying to serve all of these other smaller communities. So by bringing on nurse practitioners like Libby and I was able to support Libby through her training. It's really just our practice is growing, and then that we can serve the community better.
How many people in your office altogether?
So we have 4 providers. We have, and then Dr. Richley as well. Yeah. So we have Dr. Van Vrede, who's a board certified dermatologist. Dr. Richley works with our Cadillac office 1 day a week on Fridays. Okay. He is a Mohs surgeon. I believe his main practice is in Muskegon. Is that right? Manistee. Okay. Sorry. And he does Mohs procedures, which is for our skin cancer patients, which again, huge void in this area. Mm-hmm. So bringing him in has been essential. And then we have 2 nurse practitioners, Libby and myself. And then we have a physician assistant, Colleen Bartosik, who is amazing and has extensive training in aesthetics. So anytime I have an aesthetics question, I'm like, hey, Colleen, because I've been more extensively trained in the medical side of dermatology, but V Dermatology really focuses on the whole spectrum, including the aesthetics. So there's the 5 of us, and we have 2 registered nurses at our Traverse City office who do aesthetics, like the filler, injectables, and we have an esthetician as well. So,
yeah, and our Natalie, the nurse injector, she is coming down to Cadillac 1 day a week now to do Botox and fillers and all that stuff. So,
So as you look at things, let's talk about your patient load and what are you treating most, and maybe what is something that is becoming more common. So maybe the answer is the same for both of those questions, but.
We treat a lot of acne, a lot of acne in teenagers and adults. Warts is a big one too. And then psoriasis and eczema are probably in the top there. Hair loss is a big one. Rosacea.
Okay, yeah.
Oh, and then obviously the skin cancers.
Yeah, I mean, we treat the whole range of medical dermatology, and I would say definitely a lot of skin cancers. I mean, the population around here, a lot of them are farmers and spend a lot of time on water, so tons of sun exposure, and so we do see a lot of skin cancers as well. I don't know that, obviously rashes, but I don't think that really there's been a big uptick in anything. It's pretty much, we say, the bread and butter of dermatology are those things that Libby had mentioned. And we're certainly seeing a lot of that in the Cadillac office.
I do think, too, there is a lot of skin cancer here because a lot of people haven't seen dermatologists, because for a lot of people it's a lot, especially the elderly population, to drive an hour and a half away to see a specialist is kind of out of the question.
On a waiting list,
right?
And then it's a great big thing, and my mom didn't see a dermatologist, so why should I have to?
Right. And the primary care providers in this area have been wonderful too, I think, at providing those services for the skin checks and stuff. But as somebody who's worked in primary care, it's really hard to be able to treat the full gamut of everything. So I think this is just, so much of a blessing for our community to be able to have derm here. Yeah.
So if a primary care physician refers, what's typical wait time for someone to get into your office?
Right now, maybe a couple weeks.
Okay.
Yeah, I think the summertime is maybe a little bit harder because all the snowbirds come back.
Right. From being in the sun.
Yeah, from being in the sun. So we're extra busy. But yeah, right now there's not a real long wait time. And that is partially due to having as many providers as we have. So Dr. Van Vrede does come down to Cadillac 2 days a week as well. So
great. And you keep him busy.
Yeah.
Let's talk about, I made a promise to my daughter about a year ago, no more tanning beds. And I'm going to tell you, I miss the tanning bed. Can we talk about that for a minute? I think there's, I don't know, not a lot of long-term knowledge about this type of thing. So I want to hear it from, the horse's mouth, as it were, Rich.
Yeah, well, I'm, for one, happy that you made that promise.
Okay.
Honestly, I've seen a lot of patients who got melanoma early on in their lives, like 20s and 30s, and it was because of using, artificial tanning beds. So we have so many great fake tan sprays now that you can just look gorgeous in. But I hear what you're saying because I think it does feel nice, like to get that little dose of vitamin D.
Right.
And so we definitely want people to get sunshine, get their vitamin D. Just do it outside in the natural light wearing your sunscreen.
What are the earliest signs of skin cancer? If someone has a mole that they're worried about, or a spot, because I will tell you, my dad has had skin cancer twice. He has had a growth removed from his nose, and he plays a lot of golf.
Yes, the golfers are high risk.
Exactly. So, what are we looking for?
Yeah, well, so there's 3 main types of skin cancers that we see and that we treat, and those are your basal cells. I'm guessing that may be what your dad had.
It is.
Yes. And then there's the squamous cells and there's melanoma. And I always tell people they're kind of like a range. I mean, if you're going to have skin cancer, you want a basal cell. Not that anybody wants skin cancer,
right.
But those are the least, invasive as far as like they're not going to metastasize and cause any death or anything. So they can cause a lot of tissue destruction, though, so we do want to capture those early. Okay. But basal cells tend to kind of come out of nowhere. They grow really rapidly, but they're on those sun-kissed areas where people who have had a lot of sun exposure. So, if you notice something, and those are usually like these pearly, nodular-like growths, and oftentimes on the face, the neck, sometimes the arms, too, especially with the golfers, definitely let your provider know as soon as possible because they do come up quickly. So you're going to notice like, man, this was not here before. Okay. Squamous cells also, they can come up really, really quickly. I always describe them, and I don't know if you think this makes sense, but like to me, they look like little volcanoes that have just like erupted on somebody's body. They're very hard, and they're just, again, come out of nowhere. Okay. But there are signs that people can see ahead of time, and those are the precancers. And Libby kind of alluded to those when she was talking about like the left side of our body and all the sun exposure. So when we're treating those precancers, we do tend to see them more on the left side of the body because of driving. And those are like these little rough, scaly patches on your like your face, your arms, your hands. No matter how much you moisturize them, they're not going to go away. So like if you have something like that, definitely talk to your provider about it. And then of course the worst case is going to be melanoma. And so like we talked about those A, B, C, D, E's, and people who are fair and people who have more moles and freckles, they're going to be higher risk. People who've had severe sun, even one sunburn in your life increases your risk. Family history, all of those things. So if you are someone who has moles and freckles, I would just keep an eye on them. Yeah. I'm looking at you.
They're all over the place.
Exactly. And like I was just describing you, fair, moles and freckles. Yeah. So you definitely.
I feel judged.
It's really good to keep an eye on it yourself. And like if you have a significant other or a family member who can check your back, that's great too. But like have your provider take a look, and honestly have your dermatology provider take a look, right? Because they know exactly what to look for, and we can flag things, take measurements, take photographs. And again, that way we know, like, is it changing over time? Do we need to have a concern about it?
When you talk about moisturizers, I think that there's, maybe a stigma that moisturizers have to be expensive, that face creams and things like that have to be, a designer or brand names.
Absolutely.
Tell us what we should be using.
Yeah, I mean, honestly, like, and I'll let Libby say what her favorites are, but my favorites are, and I think we actually both use the Neutrogena Hydro Boost. We get the pack from Costco.
Okay.
Buy in bulk, huh?
Buy it in bulk from Costco. It's great. I mean,
Okay.
it has hyaluronic acid. It's really moisturizing. It feels nice and satiny going on. Like, it doesn't have to be anything fancy. The other one that I really like is by La Roche-Posay. There's one called Lipicar Balm, and it sounds super fancy, but it's like less than $20.
Okay.
So those types of things are really great. You don't have to like break the bank. The other thing I just want to say quick before getting your favorites, Libby, is like, I always tell patients, do not, and I'm sorry, Bath and Body Works, but like, do not use because the fragrances and the dyes, they just dry out our patient's skin so much. So they smell amazing, get the candles, but like, don't use the products because they just really dry out your skin.
So what you're saying is the less scent, the safer the
Absolutely.
Okay.
I always tell people, like, go for the things that you think about, like old people use, Gold Bond, Jergens, like that's the good stuff.
Okay.
oil of Olay. Oh, my grandmother, oil of Olay. Yeah. The smell brings back memories.
Yeah. No. Neutrogena Hydro Boost is what I use for moisturizer, and then I really like the CeraVe products. That's what I use to wash my face, and
Okay.
yeah, I mean, we're not high maintenance. Our estheticians would probably disagree. But, I mean, you certainly can invest more money into products, and that might work a little bit better. But I think, the basics are just fine.
Mm-hmm.
So, yeah.
When it comes to getting older, do we change up our regimen when we get older, or we know we should be putting sunscreen on our littles. We know we should be wearing sunscreen, but as we age, like you said, check each other for moles, check your loved ones for moles. What else?
Yeah, I was just going to say a retinoid is really important. So like Retin-A,
Okay.
tretinoin, that kind of thing. I mean, I use that now and I'm in my 30s, but it does reduce fine lines and wrinkles and helps just overturn those skin cells a little more rapidly so that you smooth out the discoloration and all that. So I would say that would be something I recommend to everybody. Yeah, male, female, young, old. It's just great.
And I am seeing kind of a new emphasis on skin, and maybe that's just in the last few years, but it really is, part of the total package.
Yeah.
And I bet when you two are talking to people, it's hard for you not to analyze their skin. I bet it's hard for you not to check. Like you said, he's fair. He's got,
I will say I was at a water park a couple weeks ago.
Oh, no.
And I kept seeing people and I thought, oh man, I hope they're seeing a dermatologist. Because you do do pick out moles and different rashes that you're kind of,
Or I hope they're putting sunscreen on their children at the water park.
Yeah. Well, this was indoor, so I haven't gotten that judgmental yet.
And, well, as someone who works in the dermatology field, is there ever a temptation to walk up to someone and say, "It looks like you need"? That would have to be such a hard topic to broach,
Right.
Yeah, I don't know.
But it would be glaring to them. Or someone who's very burned. Don't do that again.
Right.
I think if I saw someone with an obvious skin cancer, I would point it out to them kindly. But yeah, I don't know. You might feel differently.
Yeah, no, I mean, I'm trying to think. I don't think I've ever been to somebody, oh man, you better get that checked. But yeah, because it's a little awkward,
Yeah.
But yeah, I think like Libby said, if we saw something that was truly concerning, we would recommend that it get seen. But yeah, it just going back to all of the products and what you should be doing, I think there are a lot that are available, that people are accessible, the retinoids too. You can get those over the counter.
Okay.
So adapalene is over the counter. as different. And so there's just like lots of things you can do to take care of yourself. But yes, I was actually just on vacation in Palm Springs, and there was this lady who was like as red as a lobster, and I was just like, oh my God. I felt so bad for her, but I didn't say anything because, you never know where that's going to go.
Right. Yeah. If it would be well received, or she would recognize that you're being helpful. When I think of dermatologists, I think of sports rashes and these kids, that are in these uniforms. And in my case, it was football gear at my house. And it's one thing when your boy, has a really bad sports rash. I mean, he almost looked like a giraffe. Like that was sort of the patterning, which was one thing, and we were going to go ahead and get that handled. But then through the washing machine, then my daughter got it right before prom, all over her back. No. And all of a sudden the sense of urgency went from, we should take a look at this, like,
do something now.
Yeah. So what would you tell parents of athletes who, everybody's clothes are all getting thrown together, and we've got sweaty sports equipment. I mean, can you tell us about that?
Yeah. So it sounds like the draft pattern. I'm guessing that was probably tinea versicolor, which is actually like a yeast type infection on your skin. Mm-hmm. It's super common in athletes and young people and into our 20s, but you can easily treat that at home with Selsun Blue shampoo. So get some Selsun Blue.
These guys have like ancient Chinese secrets in here.
And
are you kidding me? Awesome.
If it doesn't work, obviously come in. We can get you something stronger. But Selsun Blue has antifungal properties, and you can use it as a body wash. So you just lather up in the shower, use it as a body wash, and then 10 to 15 minutes later, you have to let it stay on. So 10 to 15 minutes later, then rinse it off. So the contact time is really important. And then we also see like the ringworms and things with the wrestlers and, everybody. And there's so many, like, even though it says athlete's foot, it's the same medication. So buy the clotrimazole, the lotrimazole over the counter. You can treat it, but it's key to be consistent, and it's going to take time. So like twice a day for probably at least a couple weeks to get those guys to go away, but they will.
Okay. And is there anything that you should do to treat your laundry? I had a fitness instructor tell me use vinegar in your washing machine. I mean, any tips on that?
I think there's the OxyClean and stuff, right? Which is really helpful for kind of disinfecting. So if you can, it's not going to ruin the clothes, and hot water and the high heat in the dryer is really important. And that's like if you have concerns about infestations too. Hopefully nobody ever has concerns about lice or scabies or whatever.
Right.
But
bad bugs.
Yeah. That's what you need to be doing is like the hot water but just like throwing in some OxyClean and stuff can be helpful.
And I think sometimes it's just unavoidable. And so, the sooner you get on top of it, the better. Mm-hmm. And we're here to help with that too. So.
Okay. I'm glad these ladies are in town.
We're hearing a lot of information that you and I didn't know.
Right.
Yeah. Mm-hmm. So in about the 2 minutes or so that we have left, we need to learn more about how people can reach you and perhaps make an appointment if they have a concern.
Yeah. So certainly call our office. I cannot tell you the phone number.
Well, they can Google you.
V Dermatology.
None of us remember phone numbers anymore. We just have it programmed into our phone.
You don't call yourself.
I'm never going to hear the end of that one.
That's okay. And maybe we won't edit that out. We'll just
so you can certainly call our office. Sometimes you need a referral, not always. In fact, a lot of times you don't. So you can just call. We can let you know
if you need
a referral or not. And and we'd be happy to see you. Otherwise, if your primary care provider recommends you see a derm, just give us a call or have them refer you to us.
Facebook page, website?
Yep, V Dermatology and Spa.com, I believe. And then you can look us up on Facebook and Instagram. Yeah. So
it's just the letter V.
Yeah, right. V for Dr. Van Vriede, because nobody can say his name, so they say Dr. V.
Okay, funny. I was going to ask you about that. Yeah. That clears it up.
Uh-huh.
Yep.
All right. Well, ladies, this has been very, very informational, and as we're getting into warmer weather here before too long, a lot of very interesting tips and some good stuff. So, anything else you want to mention before we wrap it up?
I don't think so. Do you have anything?
Apply sunscreen.
Apply your
There you go.
sunscreen every 90 minutes.
Your 2 words right there. Libby Tuck and Naila Russell from V Dermatology, our guests this morning. Thank you, ladies.
Thank you for having us.
Yeah, thank you.
More coming next week, sponsored by Independent Bank on Cadillac Unscripted 107.9.